Hello guys and welcome to my YouTube channel. My name is Dr. Peter. Some of my students and followers call me Dr. Piro. I'm a medical doctor and content creator currently working in Nigeria. And today I want to talk about something I think is very, very important, and it's the issue of medical job interviews. As a young clinician, as a young professional, you are going to have to go through job interviews before you get your job, after your internship, after your mandatory service, or whatever the process is with you. But you need to, be sort of aware of how to comport yourself during job interviews. Um, fortunately and unfortunately, medicine is sort of a regulated program. So you get your job placement is sort of a little bit different and a little bit more, sort of regulated than mainstream jobs. But nonetheless, it's important that you know how to comport yourself for a medical job interviews. So today we're going to be looking at the kind of questions that you should prepare yourself for, how to negotiate your terms of work, your salary, and how to deal with tension when you are coming into a medical job interview. So if you're new on my channel, I discuss medical lifestyle. I discuss some academic stuff here, and I talk about things that young doctors and medical students need to know when they are coming into clinical practice, so that they can be aware and they can be well equipped to be able to deal with and have a smooth transition from school to clinical practice. So if you're new on this channel, please like this video, subscribe, drop a comment and on what you think this whole channel, wow, how you see this video. Okay, so let's get straight into the business of today. So the first question you're going to have when you get into a medical interview or any job interview for that matter is, tell me about yourself. So you need to be able to have sort of a brief bio about yourself, something that you're able to share. But of course, you're going to be sharing, in a professional setting. So they're going to ask you, tell me about yourself. That question should not take you by surprise, because it's a common question that is going to be asked in every other interview. So you need to have something to tell the person interviewing you. Okay, so you tell them your name, you tell them where you're from, you tell them where you trained, where you had your medical school, where you had your internship, and then any other special job or training process that you have had prior to coming to that place. So you can give them a brief summary like that. Depending, it's good that you have something to say, but you also have to arrange it. If you have worked in 15 hospitals or 15 facilities, you don't need to tell the interviewer you have worked in 15, but you can highlight a few of the most prestigious places you've worked, so that you can put your best foot forward in that interview. So I think that's something important that you have to have ready when you're going for a medical job interview. The second thing you're going to most likely ask is, what skills do you have? What can you do? So as a medical doctor or any health professional, it's important that you have a recollection of the skills that you have. So if you're a medical doctor, you're going for a medical job interview, you should be able to say what you can do. Now, when they say what you can do, it's important that you list the highlights. So for example, if you're a medical officer, your post internship, you can say, okay, I can manage trauma cases, I can manage regular obstetric deliveries, I can do suturing, I can do circumcisions, I can work on ingrowing toenails, I know how to manage wounds properly, I can manage unconscious patients. Of course, like, I'm not sure you'll be able to exhaust everything you'll be able to do, but the most times the employer wants to know about key things. Can you manage medical emergencies? Can you manage basic surgical emergencies? And then those are the things that he will expect you to list. All right. And usually in the course of that interview, you're going to have a clinical scenario that is going to be typically based on the skills you should have for the job that you're looking for. In medicine, there's a wide array of things to learn, but it's very likely that the most common things you already know them if you're actually going for a medical job interview. And for the parts that you're going to parts that you're going to probably have a little doubt of, just getting in the line of saying what is right or a variation of what is right is enough most times for most employees, especially if you can express yourself confidently. You show that you are willing to do, to work with other people when you are managing your patient. I think that will be that you'll be home and dry with that. The next question you're likely to be asked in a medical job interview is your salary expectation. And I think this is very, very important. In fact, I think this is the crux of this video, your salary expectations when you are going for a medical job interview. Now, before you go for your job interview, before you have this question tossed at you, I need you to know, like, you have to have some background findings. I think the most important thing is to talk to people who have worked in that facility before, so that you know what is expected, like what you expect, and what is the average pay people of your cadre earn when you're going to that job interview. Now, although you know what they earn, you have to also marry it with yourself, like with what you are bringing, what you're going to be bringing to your patient care, such that you get good value for the service, your services you are rendering. This is particularly important for job adverts where you hear things like salary negotiable. Now we know that there is a range where medical officers, interns earn, right? There's a range of pay where they earn. But if they put a caveat that that job, the salary is negotiable, then you have to put your best foot forward so that you can actually, negotiate to your advantage. The one goal of employees is to make profit from their business, and they'll like to get labor at the cheapest possible cost. They'll like to get, the most qualified labor for the cheapest possible cost. It is up to you to negotiate such that you get your work's worth in terms of salary. So it's important that you know how to negotiate. Now, the factors to consider when you want to negotiate is your experience, the skills you have, the average pay of the people in your cadre, the special knowledge and special skills you're going to offer in patient management, the work schedule, what is the work schedule. And I think it's also fair, if you want to be considerate about yourself, is to ask, what is the workload in the facility. When you're working in a high flow hospital where you're going to be seeing, 10, 20 patients, per shift, and it's different from when you're working in a specialized, a special center where you're going to be working with 3 or 4 patients a day. So your workload is, you have to factor this when you are negotiating for your rota. Like, how is your work schedule? Are you going to be working every day? Are you going to be working weekends off, nights off? Are you going to be working shift? Are you going to be working 8-hour shifts, 6-hour shifts? Is it going to be 2 people working in a day, so a 2D, a 2 doctor shift? Is it going to be a 3 doctor shift? Are there going to be 3 shifts in a day? So that these are the important factors that you should consider before you start negotiating your pay. So, I think by the time they are getting to that point where salary negotiations are beginning to start, it is important, as you, the interviewer, to ask the employer, what is the schedule here like? What is the typical workload? That will give you, that it's an interaction. The interview is an interaction. Even though they are interviewing you, you also have an opportunity to see the people interviewing you. Of course, the people interviewing you will likely be the HR, depending on the size of the organization, or maybe the supervising doctor, or a manager, or someone like that. Now, those people, if you have the right to ask them, what is the schedule like, what is your roster going to be like, and what is the average workflow, in that particular place. Why is a forward and forthright question? You should do it politely, but you have the right to do it because it's going to inform you of how you're going to negotiate. And if you are, if you are really savvy about this, you can actually ask these questions, anonymously before, getting to the job interview. There are many ways to get insight into companies. They have many employees, they have reviews online, so you can check all these things, get a contact of someone working, and then you can approach them. Please, I'm trying to get a job in your facility. Please, can you give me an idea of what the work schedule like, what's the average typical pay, and what's the workload like? So that will inform you of what you are expected to do. So once again, before you begin your salary negotiation, you need to have an idea of the schedule. You also need to consider, as I said earlier, the special knowledge, the special skills, and special services you are going to be bringing into the facility. Some facilities are startup facilities. The hospital is quite new. It's 2 years old, it's a year old, it's 6 months old. So you're going to be doing some level of marketing, but medical marketing is kind of different. So you're going to be doing some level of, publicity of your facility. So that's an extra job. You are going to be doing medical outreaches. So if you're going to be doing all that, you should factor that in. If you're going to be factor that into your negotiation. So you do special procedures, you do ECGs, you do ultrasounds, you can put the chest tube, you can pass the central line, you have specialized training. Factor that into your salary negotiation and make it clear to the interviewer. Now, it's important not to lie, because I'm going to tell you some of the don'ts you don't have to, like some of the things to avoid in medical interviews. But as I said earlier, put your best foot forward so that your employer knows the value of the employee that he's getting, because this is going to affect, what it thinks you deserve as your salary, and it's also going to prepare you so that you can confidently negotiate for what you also think you deserve. A negotiation is pull and pull. So the employer is on this aspect, you are on this part, and then the point is who to split the difference such that you can be at a comfortable place. Now, the reason why I'm doing this video is because I talked to some of my colleagues, and some of them are excited to go to work. Like, they're happy to go to work. Now, being happy to go to work, as Simon Sinek here on YouTube said, like, it's a joy. You're going to be spending a significant amount of time at work. In fact, it's very likely that the friends you have right now in your immediate environment are either people you schooled with or people you work with. Now, if these people, like, you're going to be spending a significant amount of your time, if you're working an 8 hours a day, that means you're spending 1/3 of your time, of your lifetime, essentially, at least during the period of you working there, at work. So you need to be excited to go to work. And one of the points, a very critical point where you're going to know if you're going to be happy where you're going to work, is during the interview, during the job interview. So you can really know what's up, what's obtainable, and so that when you are getting, you can get in. So that when you wake up in the morning, you don't feel like like it should be 6 p.m. the previous day so that you can sleep again, or you want it to be weekend all the time. Like, you should not just be thank God it's Friday. It should be thank God it's Monday. Like, and the time where you're going to know if you're going to be happy where you're going to work is very likely at the job interview, and when you're doing the background check in the facility where you're interested in remuneration. It is the wage for the service you have rendered. If you feel unconsciously that it's not in keeping with the work that you've rendered, then you will really not be happy working there. Of course, but besides salary, there are other factors that can make you happy at work, toxicity at workplace, and all that. But today we're talking about job interviews. I think there'll be separate videos for things like that. So we're talking about job interviews. So have this fact before you come in for the job interview and before you start negotiating your salary. Now, I also want to say that it's important that you are crystal clear in the interview. What is the schedule like? Do you have public holidays off? Are you going to have leave, paid leave? Are you going to be having days off? Have this thing very clear. Now, when you want to ask a question, many young employees, many young professionals get into job, they want to please. All right. So maybe during the job interview, you don't want to seem too forthright, or you are too money minded. You don't want to, seem like that to your employer. Why that is laudable is also important. That this is probably, people don't really negotiate their salary so much, in a regulated wage environment. It happens once a while. Increments come in seldomly. So this is the time where you're going to actually have to put your foot down and do it without fear or favor. Do it without remorse. But of course, be polite when you do it. So when they say, okay, you're going to be earning XX dollars, you can say, okay, you can rephrase that question. So if I get you correctly, I'm going to be working 5 days a week for 9 hours every day. And you say, if I understand you well, I'm going to be working 5 days a week for 9 hours every day, and the total salary at the end of the month is going to be XX dollars. Asking the question like it's a very polite question, but it probes the interviewer to rethink the figure he just told you and to put him at the point of a defensive. As I said earlier, it's a negotiation, it's a pull and push game, but you have to also have some tools when you are coming in to that interview. Now, one of those skills that you can use to actually negotiate the number in terms of your salary is you can make an opening like this. At my previous place of work, I was paid this. I have a concurrent offer, a job offer right now the salary is they're willing to pay this. And in that second line, your second phrase, your concurrent offer that are willing to pay this and so, you can say the salary, the figure you want. And then you can close like, I'm looking forward to the offer. I'm looking forward to your offer. However, I'm willing to work for you if you are at least willing to match this offer. All right. So you have given your interviewee a perspective that you have earned $5 in your previous place of work. You have a concurrent offer for $7.5. You are willing to work at this place if they're willing to match this offer. So that is one push. That is your push, and then you can now wait for the response of your employer. I want to advise you that at any point in your job interview, I think you should be willing to walk away from that job interview. Being willing to walk away leaves nothing at stake for you. The reason why is, except it's somewhere you really love to work and it's a very prestigious place and it has been your dream to work there. But even if you go there, if you go to that interview all green with all that, it's very likely that an interviewee would take advantage of your enthusiasm and give you a low cost pay. Now, there are times where you have to take the low pay or the unfair pay or the wrong negotiation you've done because of the advantages, the seeming advantage, because you want to learn, you want to work at a particular place, you want to add it to your CV, there's a particular work ethic you want to learn, you like that corporate culture and all that. There's a time to, negotiate based on what you want to get. But if you're talking about the numbers, then I want you to go like you can leave at any time. And don't just pretend it. Actually mean to be able to leave at any time. Because we're working in a place, as I told you earlier, your work life is actually going to matter a lot to your mental health and to your overall life generally. It's good that where you work, rewards you proportionately for the services you offer. It is very, very important that when you go for your job interviews, go with a copy, go with a hard copy of your documents, so your certificates, your transcripts, your your license, your ID cards. Go with a photocopy of all these documents. I know you applied for the job online. The interviewer have likely seen the e-copies of your documents, but please don't just go empty-handed. Go with hard copies of your documents for your interview, such that when they say, can I have a copy of your CV, you can now present it at that point. Don't go empty-handed and expect them to have seen it. And I don't think it's really professional, or it's really right to give them an e-copy of your document when they ask for a hard copy. It's it tells the examiner that the interviewee that you are really not ready for that interview. So come ready for the interview. Come with stationaries. Come with all the copies of the documents that qualify you to apply and to get that job. Something else I should mention is you don't have to just negotiate for the number in your pay. It's not just about $25 to 2,000 naira. No, that is not just what you have to negotiate with. You can negotiate not just in pay in monetary terms. You can negotiate based on days off, paid leaves, bonuses. So some places benefits such as the health benefits. So you have dental care free. You have you can access care in the hospital you are, or in a facility you are trying to work. Those are other ways, other non-monetary terms that you can use to negotiate. You can negotiate based on, okay, some people give data allowance, some people give internet allowances, some people give transport allowances, some people will even offer you an accommodation, So those are subtle things. So if they offer you all these things, you see that a lot of your expenses that you're supposed to make from your salary have already been made before you even talk about negotiation. So there are non-monetary terms that you can actually use to negotiate. And especially time off is an important one, so that you can study, you can rest, you can refresh, you can also live your life, as outside work. Most health professionals, spend a lot of their time working in the hospital. And why it's important to work and the service you are giving is essential. You also have a life of your own to live, and time, is irredeemable. Money may be irredeemable, but time is really literally redeemable. So you can negotiate with those non-monetary terms. Have that at the back of your mind too. See, the goal of this whole video is to get you armed for an interview, such that even if you go to an interview and you don't get the job because your employers are not willing to match your terms, you will give them a perspective of how they should treat the next person coming for the interview. And if a significant amount of young professionals imbibe these negotiation skills and these interview skills, pockets of employers all around begin to know that, okay, this is what is important. This is how they should be considering when they want to put out job offers. Don't forget to discuss things like tax, the difference between net pay and gross pay. Now, net pay is where you're going to get your bank account. Gross pay is what is going to be paid to you from the facility. But what you get paid grossly is different from what you get net pay or take home, as they used to say. So if your gross pay is $10 and your net pay is $5, then you've lost like $5 in just between your payment and your bank account. I don't think that, no matter how high your gross pay is, you should correlate with your net pay closely for you to really know that, okay, yeah, you're doing, your negotiation is really nice. Anyway, so thank you for watching this video. If you learned anything, drop it in the comments section below. If you like this video, if you enjoyed this video, like it, subscribe to this channel, and watch out for more of our channel. The next video will probably be talking about toxic workplace and communication in the workplace that will allow for smooth clinical work, and then eventually we'll be talking about other actual clinical academic stuff that will be helpful. Thank you for watching again, guys, and see you in my next video. Cheers.